Okay guys, we're back, and our patient is here on the table, and we have, those of you who had tuned in before, you saw that when I was numbing him, and he did really well with that, and we've just waited, good, I guess about 15 minutes or so for that numbing to fully kick in, and he should be good to go now. The next step is now to create little tiny slits where the hairs are actually going to go, and it's not just about poking holes. There's a lot of artistry that goes into this in terms of the right direction, the right density, the right angle, a lot of different things. We're using what's called a Mindy knife, and you can see that it has an angled blade on it, and it's 1.3 millimeters. We have actually chosen this size because it matches the caliber of his hair follicles, so this comes in different sizes, and so it's not a one-size-fits-all operation. And while I'm actually doing it, unfortunately I won't be able to field any questions because I have to count, because as you know we're making only the number of slits for the amount of hairs that are going to go in, so I can't lose count. But certainly answer any questions that you guys have when we take a break from making some of the slits. But right now we'll make a few hundred slits, starting on the side and working towards the middle, and then I can answer any questions after that, or if there's any questions that you have for Kasia here, who's videoing this, that are not medical related, maybe more price or something like that, she can answer questions, but I won't be able to talk to you guys, otherwise we'll lose count. Okay?
And you guys could tweet questions to us also at LP Surgeons, which we'll be able to answer afterwards.
So I'm going to have you turn your head a little bit here, and you could just tell everybody if you're having any pain or anything. How you doing, okay?
No, I'm fine.
Feeling kind of sleepy, but you're breathing on your own. You don't have any kind of breathing tube or IV or anything like that. We're just, we just numbed you, so I don't think you'll feel anything. We'll do a couple of test ones here just to make sure. Okay? If you're having any pain, just tell me.
Very clever.
Okay, we're going to take a little break here. We've created 400 slits across the front of the hairline, the right half, all the way down to the temporal region over here. So we started in the temporal region, went all the way back into the temporal recession, and then worked down here to lower the hairline effectively about a centimeter for him. And he's done very well. I actually fell asleep there for a second. I heard some snoring. But how you doing? Okay? I guess he's asleep. All right. So while we're taking a break here, are there any questions that anybody has about what I was doing there?
If you could explain maybe kind of the your marking on your glove, is that to help you count?
Yeah, these are basically a hash mark. So 1, 2, 3, 400, and then when I get 500, I'll just make a line across there, and then we'll start a new box for the other 500 grafts that we're going to do.
And how did you know how many to do?
Well, when I first started doing this, years ago, I would make a grid pattern there, and so I'd know how many hairs I'd have to put in each box. But as time goes on, it becomes more of an artistic procedure. The more of these that you do, and I have it in my head how many slits I'm going to make in a certain area, and as you can see, basically without doing any type of grid pattern or marking or anything, I was able to fit exactly 400 on this side of the head. We'll do approximately the same number on this side of the head, so that'll be 800, and then we'll put about 100 in the frontal forelock and about 100 in the crown region.
And what about blood loss from what you were just doing? Is it significant?
There were a couple of sponges that had some blood on it, but a lot of what you see leaking out is actually anesthetic that's just mixed with blood, so that's why it looks red. So the total blood loss is really only a couple of sponges worth. We don't use any suction or anything like that. So when we're doing our report after the surgery, if you're doing like major surgery on somebody, report like 50 cc's of blood loss or 200 cc's of blood loss, we report this as minimal because it's usually less than a total of 10 cc's of blood that's lost with a procedure like this, which is about the same amount of blood that you give when you're getting your blood test done with your doctor.
And so the hair that was being extracted under the microscope, that's what you're going to be implanting here.
Exactly. So I create all the slits, and there's artistry that goes into creating the slits, and then after all of those are made and all the hairs are dissected, then we'll actually slide those hair grafts into these slits.
If you guys have any more questions, keep them coming.
We're going to get started here with the other half in just a minute, and as you can see, he slept through a lot of that. He hasn't felt anything, and he's just mildly sedated with some oral medication and just some injections to numb him, like a dentist, and he felt nothing. Alright, so we're going to have you turn your head this way for us.
All right, guys, Dr. Ende is going to go back to, he's going to be counting, so hold your questions till he finishes, and then we'll be able to get those answered for you guys.
If there's any questions right now, I can answer them, but once I start, then...
How long does the whole procedure take?
He'll be here for about 4 or 5 hours with us, but the amount of time that we're actually touching him is only about 2 hours. The other time is just the stuff that's going on under the microscope. Actually, why don't we take a look at this side? As you can see, I know a lot of you saw some blood during the surgery, but now you can see it's just stopped bleeding. There's really nothing coming out. I haven't done anything except for had a little gauze on it for a few minutes there, but there's no more bleeding at this point. So a lot of what you saw leaking out wasn't actually bleeding, it was just some of the anesthetic that was mixed with blood. Turn this way. Okay, very good. So we're going to get started over here now. So I won't be able to field any questions for a little while.
Yes, Sheila.
Okay guys, so that's exactly 800 slits on each, for the whole front, so about 400 on each side. We met in the middle there, and there's a little bit of oozing, but that'll stop fairly quickly. And then we're actually going to make a few slits up here in the frontal forelock, and we're going to make slits in the crown region next. But the most important area for our patient is the hairline and on the sides, so that's why we created all those first. And it took 800 hair grafts to do that, which is pretty much exactly what I predicted. And so we have 100 left over for this and 100 left over for the crown region. At the end of the slit creation, we'll get the exact count of how many hairs we have, and if we have a few extras, we could always make a few more slits towards the crown or towards up here, but we really have no more room to put any across the hairline. That's the maximum density that we could really do for our patient here.
Somebody else had a question if there is a maximum that you could put in, or does it depend on each patient?
Well, no, there is a maximum that you can put in. If you try to put in too much hair in a given area, thinking that more is better, it's not always better because it doesn't necessarily grow. It needs a blood supply. So if you overcrowd in an area with hair, it's not necessarily going to grow. Generally speaking, about 65 to 70 hairs per centimeter squared is a good number to reach. Anything in the 80s generally doesn't grow as well. Normal scalp hair is about 100 hairs per centimeter squared, but as people start to lose hair as they get older, it generally goes to 70 or 80 anyway. So you're just trying to match the density that they have and not go above that. So yes, there is a maximum. So this little oozing will stop. The other side, I don't know if Cassie can show you over here, but you can see that there's no more oozing over here anymore. And then this should stop within the next couple of minutes here. Just a little bit on the sponge, so we'll just put a little pressure on that and that'll stop. And these slits stay open, for many, many hours. So later on today, when we come back in to put the hairs in, we'll probably take a break in a little bit, and then we'll bring you back live when we start putting the hairs into these slits.
And we're coming to you guys live from New York City from our Manhattan office, Lexington Plastic Surgeons. Dr. Ende works here out of our New York City office. And some people joined in for this, but they haven't seen some of the earlier stuff. Can you explain where you took the hair out of? Or?
Sure. So basically what we did was a follicular unit transplant procedure where we took a strip of hair from the back of the scalp. We didn't shave the back of the scalp or anything. We just took the strip of hair out, and then we let his natural hair come back over it. So he does have some sutures in the back, but they're fully covered with the current hair that he has. And that scar should fade away. We did a trichophytic incision and closure where the hairs will actually grow back through the scar. It's sort of a two-step process that we showed live on the video before. And once we did that, we stitched it closed and we laid him down like this and did a little bit of numbing, and then started to create these slits. What we were showing you guys before was under a microscope. We had taken that strip of hair and we were dissecting it into slivers first, and each of those slivers contained about anywhere from 7 to 10 follicular units. And then once those slivers are all created, the next step is going to be to dissect it into actual follicular units, which contain 1, 2, or 3 hairs, and then we'll start transplanting those into these slits that I just created.
So how long will he be resting before you guys start that?
Yeah, he's going to be resting for a couple hours, while those hairs are actually getting dissected. If he has to get up and use the bathroom or whatever he wants to do is fine. We have a nurse that's here watching him and monitoring him throughout the procedure, which is actually it's different than a lot of other hair restoration clinics. Lexington Plastic Surgeons is a fully accredited operating room. Most hair transplant clinics, even in New York, are not accredited, so we take a lot of pride in our accreditation. And on top of that, we're monitoring him. A lot of hair restoration procedures go unmonitored, and although it's minimally invasive, it's a nice thing to do to make sure that there's no issues with some of the injections we're doing. So he'll be laying here monitored for the next couple hours, and then we'll come back in and me and Rhiannon will start placing some of the hairs into the slits that were created.
And just one last question for those of you asking. Dr. Ende said that it does start at about 5,500 and goes up from there. It all depends on each patient's needs, correct?
That's right. Yeah, 5,500 is our starting price. This is not just a back room where we're performing this in. So certainly, if there are some offices that have a room in the back where they do some transplants, and the cost can be less. But this is a fully accredited surgical center. We get regular inspections, and we take a lot of pride in our accreditation status. And you're also getting me, who's done over 10,000 surgical procedures on the face and the scalp. So we're certainly not the highest price by any means, but you could probably find a bargain, somewhere else in terms of price.
So we will be back in a couple hours where you guys could watch Dr. Ende actually putting in the hair follicles.
See you later, guys.